Rheumatoid arthritis and Crohn's disease, when your body attacks itself. Hello, dear listeners. What if one morning your wrists moved like rusty machinery? Or what if foods you've digested without problems your entire life suddenly caused stabbing pain in your abdomen? This is the daily reality experienced by patients with rheumatoid arthritis and Crohn's disease. How would you feel if the immune system that has protected you throughout your life suddenly recognized you as an enemy and began attacking? This is not mere imagination. In rheumatoid arthritis, our own immune system mercilessly attacks the synovial membrane of joints, and in Crohn's disease, it attacks the intestinal wall. It's like experiencing the betrayal of your most trusted friend, stabbing you in the back. But your body directly experiences this betrayal. Rheumatoid arthritis and Crohn's disease share the commonality of being autoimmune diseases. However, their manifestations and the body parts they affect differ. Rheumatoid arthritis is an inflammatory disease that primarily starts in joints and spreads throughout the body, while Crohn's disease is a chronic inflammatory bowel disease that can occur anywhere in the digestive system. Many of you listening to this audiobook may have already received such diagnoses, or perhaps beloved family members or friends are in this situation. The doctor spoke in a calm but firm voice, saying it's a lifelong condition requiring management, and internet search results likely painted an even more bleak future. However, the message I want to convey through this journey is not despair, but rather hope. While these two diseases are certainly difficult companions, we are not completely powerless beings. Along with advances in modern medicine, we have integrated and holistic paths to healing available to us. Through today's story, you will come to understand the reality of these complex diseases called rheumatoid arthritis and Crohn's disease, scientifically, philosophically, and practically. We will comprehensively cover everything from medical facts to psychological responses and practical management methods for daily life. Chapter 1: Rheumatoid Arthritis, a systemic war starting in the joints. To understand rheumatoid arthritis, we must first know how our body's immune system works. The immune system is like a highly trained army. Billions of immune cells patrol our body 24 hours a day, identifying and eliminating invaders. This amazing system has the sophisticated ability to distinguish between self and non-self. But in rheumatoid arthritis, a fatal error occurs in this perfect system. Immune cells mistakenly recognize the synovial tissue of joints as foreign invaders and begin attacking. It's like a loyal guard dog suddenly biting its owner. To understand this phenomenon, we need to know the concept of immune tolerance. Under normal circumstances, our immune system is educated from birth to recognize its own tissues as friends. In an organ called the thymus, T cells undergo a strict screening process, and cells that attack self-tissue are eliminated. But sometimes this educational system fails. In a phenomenon called molecular mimicry, parts of external viruses or bacteria have structures similar to our body's tissues, causing confusion in the immune system. It's like being unable to distinguish between twins. The onset of rheumatoid arthritis is subtle. Patients initially feel a vague sense that something is wrong. Symptoms like hands being stiff when waking up in the morning, getting tired more easily than usual, or having unexplained low-grade fever. These symptoms are so general that most people dismiss them thinking it must be stress. But the immune system has already started a war. Inflammatory cells flock to the synovial membrane, a thin membrane in joints, and inflammatory mediators are secreted in large quantities. Normal synovium consists of thin 1 to 2 layers of cells, but in rheumatoid arthritis, this synovium thickens like a tumor. Synovial cells proliferated into dozens of layers form tissue called pannus and erode cartilage and bone. Interestingly, This process is very similar to cancer cell proliferation. Synovial cells ignore normal growth inhibition signals and proliferate indefinitely. Here, adding a slightly cynical perspective, the efficiency worship of modern society shows strange similarities to the characteristics of such diseases. The immune system, like an organization obsessed with excessive performance orientation, cannot stop unnecessary attacks and continues trying to produce results. The destructive nature of rheumatoid arthritis is also revealed in its symmetry. If the right wrist hurts, the left wrist hurts too. This is evidence of a systemic immune response occurring. It's like orders from the central government being simultaneously transmitted to all branches nationwide. Morning stiffness is one of the most characteristic symptoms of rheumatoid arthritis. Patients describe that when they wake up in the morning, their joints don't move as if they're rusted. This is a phenomenon that occurs when inflammatory substances accumulate in the synovium overnight, and it generally lasts more than 30 minutes. Rheumatoid arthritis is also a systemic disease. In addition to joints, it affects the eyes, lungs, heart, blood vessels, and nervous system. There are also characteristic symptoms called rheumatoid nodules. Hard lumps appear near the elbow or finger joints, which is a phenomenon caused by immune complex deposition. Cardiovascular complications are hidden dangers of rheumatoid arthritis. Chronic inflammation accelerates atherosclerosis, increasing the risk of myocardial infarction or stroke. The cardiovascular disease risk for rheumatoid arthritis patients is 50 to 60% higher than the general population. Chapter 2. Crohn's disease. Civil war inside the intestines. To understand Crohn's disease, we must first know how complex and sophisticated our digestive system is. The intestines are not simply organs that digest food. About 100 trillion microorganisms live here, and more than 70% of our immune cells are distributed in the intestinal tract. In some sense, the intestines can be said to be the most important boundary between the external world and our body's interior. In Crohn's disease, the immune system begins to mistake beneficial bacteria that should normally exist in the intestines as enemies and attack them. This is like a civil war situation where civilians of one's own country are mistaken for enemy forces and attacked. As a result, inflammation occurs in the intestinal wall, and over time, ulcers and scars form. Medically, Crohn's disease can occur anywhere in the digestive system from mouth to anus, but it is most commonly found in the terminal ileum, end of small intestine, and the beginning of the large intestine. One characteristic of this disease is its partial and irregular inflammatory pattern. Like patchwork, healthy areas and inflamed areas appear alternately. Symptoms of Crohn's disease are diverse and complex. The most common symptoms include chronic diarrhea, abdominal pain, weight loss, and fatigue. But this is not all. Crohn's disease can also cause symptoms outside the intestines. These include arthritis, skin diseases, eye inflammation, and liver dysfunction. These various symptoms show that Crohn's disease is not simply an intestinal disease. Rather, it's more accurate to view it as a complex disease affecting the entire body. This is consistent with the concept of qi flow in Eastern medicine, the perspective that imbalance in one part affects the whole. One of the greatest difficulties Crohn's disease patients face is the unpredictability of the disease. Someone who was fine yesterday might suddenly be rushed to the emergency room with severe abdominal pain today. This uncertainty brings great psychological stress to patients. Here, adding a slightly cynical perspective, modern medicine still doesn't completely understand the exact cause of Crohn's disease. Various hypotheses are proposed, including genetic factors, environmental factors, and immune system abnormalities. But there's no clear answer as to why some people get Crohn's disease and others don't. Research results continue to be published, showing that the fast pace of life and stress in modern society influence the onset and exacerbation of Crohn's disease. Interestingly, there are statistics showing that the incidence of Crohn's disease is high in developed countries and relatively low in developing countries. This suggests the possibility that our civilized lifestyle may actually be disrupting our body's natural balance. A particularly noteworthy point in Crohn's disease is increased intestinal wall permeability, or leaky gut syndrome. Normal intestinal walls have selective permeability, absorbing necessary nutrients while blocking toxins or pathogens. But in Crohn's disease, this intestinal barrier is damaged, allowing unnecessary substances to penetrate into the bloodstream. Complications that appear during the progression of Crohn's disease are also serious. These include intestinal obstruction due to bowel stenosis, fistula formation, abscesses, and long-term increased risk of colorectal cancer. These complications sometimes make surgical treatment inevitable. However, there are also hopeful aspects to Crohn's disease. Periods of high disease activity often alternate with relatively stable remission periods, and with appropriate treatment and management, many patients can maintain normal social lives. Chapter 3. Common denominators and differences between the two diseases. While rheumatoid arthritis and Crohn's disease are the same in the broad framework of being autoimmune diseases, they show distinct differences in their detailed characteristics and manifestations. By comparing and analyzing these two diseases, we can understand the complex and multifaceted nature of autoimmune diseases more deeply. First, let's look at the commonalities. Both diseases center on autoimmune phenomena where the immune system attacks its own tissues. Inflammatory cytokines play important roles, which is also why TNF-alpha inhibitors are commonly effective in both diseases. Genetic predisposition is also a commonality. Both diseases show associations with specific HLA genes, and disease risk increases when there's a family history. However, genetic predisposition alone doesn't cause disease, and environmental factors play a trigger role. This point is also identical. The influence of stress and psychological factors also appears commonly in both diseases. Chronic stress affects the immune system through the HPA axis and is related to disease exacerbation. Also, both diseases have higher rates of depression and anxiety disorders than the general population. Imbalance of intestinal microbial communities is also an interesting commonality. According to recent studies, decreased diversity of intestinal microorganisms and changes in specific bacterial ratios are observed in rheumatoid arthritis patients as well. This presents a new concept called the gut-joint axis. Here, adding a slightly cynical perspective, modern medicine has long treated these two diseases as completely separate conditions. However, as more and more commonalities are discovered, questions are being raised about whether our way of classifying diseases is correct. On the other hand, differences are also distinct. The most obvious difference is the organs primarily affected. Rheumatoid arthritis primarily targets joints and periarticular tissues, while Crohn's disease occurs centered on the digestive system. These differences are related to the anatomical and physiological characteristics of each organ. Inflammatory patterns are also different. Rheumatoid arthritis mainly shows symmetrical and polyarticular arthritis, while Crohn's disease shows irregular and partial inflammatory patterns. In rheumatoid arthritis, the synovium is the main target, but in Crohn's disease, inflammation throughout all layers of the intestinal wall is characteristic. Gender and age distribution also show differences. Rheumatoid arthritis is 2 to 3 times more common in women and mainly occurs in the 40s to 50s. Crohn's disease has less gender difference and occurs more often in the relatively younger age group of 20 to 30s. Diagnostic methods also differ. In rheumatoid arthritis, serological tests such as rheumatoid factor and anti-CCP antibodies play important roles, but Crohn's disease mainly relies on endoscopic and imaging examinations. Joint X-rays are important for diagnosis and follow-up in rheumatoid arthritis, but CT or MRI are more useful in Crohn's disease. Treatment approaches also have subtle differences. In rheumatoid arthritis, methotrexate is the first-line drug, but in Crohn's disease, 5-ASA, or steroids, are often used first. Even in the use of biological agents, choices are made according to the characteristics of each disease. Prognosis and long-term course are also different. Rheumatoid arthritis can often maintain remission with appropriate treatment, but Crohn's disease has a stronger tendency to repeat remission and relapse. Also, Crohn's disease more often requires surgical treatment. Chapter 4. Modern medicine's approach and limitations. Modern medicine has achieved remarkable progress in treating rheumatoid arthritis and Crohn's disease. Diseases that were once helpless have now become manageable chronic conditions. However, the fundamental limitations of modern medicine are also being revealed. The paradigm for rheumatoid arthritis treatment has changed to early diagnosis, early treatment. Under the concept of golden time, it has been revealed that aggressive treatment within the first 12 weeks of onset greatly improves long-term prognosis. It's like the concept of suppressing a fire in its early stages. Disease-modifying anti-rheumatic drugs are the central axis of rheumatoid arthritis treatment. Methotrexate is the most widely used first-line treatment drug, originally developed as an anti-cancer agent, but it was accidentally discovered to have immunosuppressive effects at low doses. In Crohn's disease treatment, 5-ASA anti-inflammatory drugs are used for mild to moderate cases. Corticosteroids have powerful anti-inflammatory effects and are mainly used during acute exacerbations, but long-term use carries side effects such as osteoporosis, diabetes, and increased infection risk. The emergence of biological agents has brought revolution to the treatment of both diseases. TNF-alpha inhibitors such as infliximab, etanercept, and adalimumab are representative. These are like smart bombs that precisely block specific inflammatory mediators. Here, adding a slightly cynical perspective, the price of biological agents is astronomical. Many drugs cost thousands of dollars per month. This shows the reality that being sick is also a luxury if you don't have money. Even in developed countries, the number of patients giving up treatment due to medical expense burden is increasing. JAK inhibitors are among the latest treatments. These include tofacitinib and baricitinib with the advantage of oral administration. They suppress inflammation by blocking intracellular signal transduction processes. However, not all patients respond to these treatments. About 30% of patients don't show adequate response to any treatment. These are called treatment-resistant patients and are the most difficult group to treat. The era of personalized medicine is opening. Research is active to predict which patients will respond well to which treatments through genetic testing and biomarker analysis. However, it's still in the early stages. Side effect management is also an important task. Using immunosuppressants increases infection risk. Special attention must be paid to tuberculosis, herpes zoster, and opportunistic infections. During the COVID-19 pandemic, autoimmune disease patients were classified as high-risk groups requiring extra caution. Surgical treatment is also an important part of managing both diseases. In rheumatoid arthritis, joint replacement or synovectomy may be needed, and in Crohn's disease, bowel resection or fistula repair may be necessary. However, high recurrence rates after surgery remain problematic. A fundamental limitation of modern medicine is the lack of a holistic perspective. Patients are not simply people with sick joints or sick intestines, but human beings as physical, mental, and social entities. Social isolation, economic burden, and psychological stress caused by disease can create a vicious cycle structure that worsens the disease again. Also, the current treatment paradigm mainly focuses on inflammation suppression and symptom management. Attempts to find and solve the root cause of why the immune system malfunctions are relatively lacking. Chapter 5. Hidden communication between intestinal microorganisms and the immune system. We need to reconsider the identity of what we think of as self. Surprisingly, more microorganisms live in our body than human cells. About 100 trillion bacteria, viruses, and fungi coexist with us. In some sense, we might be called microbial aggregates, rather than humans. This intestinal microbial community is called the microbiome. It's one of the most noted research fields in the scientific community recently, and evidence continues to be discovered that imbalance of this microbiome is closely related to autoimmune diseases like rheumatoid arthritis and Crohn's disease. Under normal circumstances, intestinal microorganisms coexist in balance with each other. Beneficial bacteria like bifidobacterium and lactobacillus inhibit the growth of pathogenic bacteria and play important roles in immune system development and regulation. They communicate with immune cells like skilled diplomats, inducing appropriate immune responses. However, when analyzing the intestinal microbial composition of rheumatoid arthritis and Crohn's disease patients, distinct differences from healthy people are shown. Overall, microbial diversity decreases, and the proportion of specific inflammation-inducing bacteria tends to increase. This association is more direct in the case of Crohn's disease. Increases in bacteria like E. coli and decreases in beneficial bacteria like bifidobacterium are observed. In rheumatoid arthritis, increases in specific bacteria like Prevotella are also reported. An interesting question arises here. Does microbiome imbalance cause autoimmune diseases? Or does microbiome imbalance occur due to autoimmune diseases? Based on current research results, it's reasonable to see these as being in a vicious cycle relationship where they influence each other. Modern lifestyle habits include several factors that disrupt intestinal microbial balance. Antibiotic overuse is the most representative example. Antibiotics eliminate not only bad bacteria that cause infections, but also good bacteria that help us. Processed food-centered diets are also problematic. Fast foods and instant foods that modern people enjoy make dietary fiber that microorganisms need insufficient, while simultaneously providing additives like preservatives, artificial sweeteners, and emulsifiers. Here, adding a slightly cynical perspective, modern society's cleanliness obsession can also be problematic. Excessive use of antimicrobials and obsession with sterile environments can actually interfere with proper development of our immune system. A certain degree of microbial exposure is necessary for healthy immune system development, which is the core of the hygiene hypothesis. Stress also directly affects intestinal microorganisms. Chronic stress increases intestinal permeability through the gut-brain axis and promotes inflammatory cytokine secretion. This can lead to a condition called leaky gut syndrome. Recently, surprising research results have been published showing that intestinal microorganisms also affect our mood and behavior. Some intestinal bacteria can produce neurotransmitters like serotonin or GABA, and these can transmit signals to the brain through the vagus nerve. Fecal microbiota transplantation, FMT, an innovative treatment, is also being researched. This is an attempt to restore the microbial ecosystem by transplanting intestinal microorganisms from healthy people to patients. Effectiveness has already been proven for Clostridioides difficile infection, but effects in autoimmune diseases are still under research. Interest in probiotics and prebiotics is also increasing. However, their effectiveness in treating rheumatoid arthritis or Crohn's disease has not been completely proven yet, and large individual differences are problematic. Chapter 6. Stress, Emotions, and Quality of Life. The expression, "my stomach hurts," doesn't just mean physical discomfort. We actually feel abdominal discomfort when stressed or anxious. Expressions like heavy heart, tight chest, and burning stomach all show the connection between emotions and physical symptoms. A complex and sophisticated communication network exists between the intestines and brain. This connection, called the gut-brain axis, is achieved through the vagus nerve, endocrine system, immune system, and intestinal microorganisms. The intestines contain about 500 million nerve cells, similar to the number in the spinal cord. Results of studying the psychological state of rheumatoid arthritis and Crohn's disease patients show significantly higher rates of depression and anxiety disorders compared to healthy people. This is not simply due to stress from chronic illness. Research results suggest that inflammation itself can cause neurochemical changes in the brain. Inflammatory cytokines can cross the blood-brain barrier and directly affect the brain. Specific inflammatory mediators can interfere with the metabolism of neurotransmitters like serotonin and dopamine, causing depression. Stress affects autoimmune diseases through several pathways. First, stress activates the hypothalamus pituitary adrenal axis, increasing cortisol secretion. While this has short-term anti-inflammatory effects, chronic cortisol secretion can actually disrupt immune system balance. Second, stress changes the balance of the autonomic nervous system. Excessive sympathetic nervous system activation constricts blood vessels, suppresses digestive function, and increases inflammatory cytokine secretion. Third, chronic stress deteriorates sleep quality. Sleep deprivation impairs immune system function, increases inflammation, and heightens pain sensitivity. Here, adding a slightly cynical perspective, modern medicine tends to treat these psychological symptoms as separate problems. Rheumatoid arthritis is treated in rheumatology, Crohn's disease in gastroenterology, and depression in psychiatry separately. But from the patient's perspective, all of this is one connected experience. The stress experienced by autoimmune disease patients is multi-layered. Physical pain from the disease itself, anxiety from unpredictable symptoms, restrictions on social activities, economic burden, and the sense of loss of not being able to live a normal life all work in combination. The fact that autoimmune disease diagnoses are often made in young adulthood makes the problem even more complex. This is when important life decisions like studies, employment, marriage, and childbirth must be made. But these plans are disrupted by disease. Rheumatoid arthritis patients are restricted in daily activities due to joint pain and stiffness. Simple tasks like buttoning clothes or opening bottle caps become sources of frustration. Crohn's disease patients avoid going out or social activities due to anxiety about not knowing when or where symptoms might appear. However, the relationship between stress and autoimmune diseases is not one-sided. Research results show that appropriate stress management can improve disease progression. Methods like meditation, yoga, cognitive behavioral therapy, and mindfulness have been scientifically proven to actually reduce inflammatory markers and alleviate symptoms. The importance of emotional expression cannot be ignored. Many people raised in cultures where suppressing and enduring emotions is considered virtuous cannot properly express their pain. However, emotional suppression can increase stress hormone secretion and negatively affect the immune system. Chapter 7. The Healing Power of Food and Lifestyle Habits. Hippocrates said, "Let food be thy medicine, and medicine be thy food." This saying has particular meaning for rheumatoid arthritis and Crohn's disease patients. For these diseases, food is not simply a source of nutrition, but a powerful factor that can reduce or increase inflammation. For autoimmune disease patients, dietary therapy is like a complex and personalized puzzle. Foods that help one patient may worsen symptoms in another patient. This is because each individual's intestinal microbial composition, degree of inflammation, genetic factors, and stress levels are all different. However, some general principles exist. First is avoiding processed foods as much as possible. Preservatives, artificial sweeteners, emulsifiers, and dyes contained in processed foods can damage the intestinal barrier and promote inflammation. Additives like carrageenan or CMC have been shown to cause colitis in animal studies. Here, adding a slightly cynical perspective, the modern food industry tends to prioritize profits over our health. Products advertised as from nature often actually contain dozens of chemical additives. Consumers have become confused about what truly healthy food is due to flashy marketing. For rheumatoid arthritis patients, research results suggest that a Mediterranean diet may be helpful. Diets rich in olive oil, nuts, fish, fruits, and vegetables have anti-inflammatory effects. Fish rich in omega-3 fatty acids particularly have effects of reducing inflammatory cytokine secretion. For Crohn's disease patients, there are more complex dietary considerations. During acute exacerbations, low residue diets or liquid diets may be necessary to rest the intestines. Nuts, seeds, and raw fruits and vegetables may worsen symptoms in some patients. Identifying individual trigger foods is very important. Generally, gluten, dairy products, nuts, and seeds may cause problems for some patients, but this is not an absolute rule. Some patients digest dairy products well, and some patients have no problems with gluten at all. Keeping a food diary is a very useful method for identifying individual trigger foods. Recording daily food intake and symptom changes can reveal patterns over time. However, this process requires patience because the effects of food on symptoms may not appear immediately. Micronutrient deficiencies also need careful management. Autoimmune disease patients commonly have deficiencies in iron, vitamin B12, folate, vitamin D, and zinc. This results from a combination of malabsorption due to inflammation, side effects of some medications, and decreased food intake. Modern lifestyle patterns also greatly affect disease progression. Cities with 24-hour lighting, shift work, jet lag, and nightlife exposed to artificial lighting disrupt our body's natural rhythms. Circadian rhythm disruption can increase inflammatory cytokine secretion and disrupt immune system balance. Sleep deprivation is particularly harmful to autoimmune disease patients. During sleep, hormones that suppress inflammation are secreted, and damaged tissue recovery occurs. Sleep deprivation can interfere with these recovery processes and perpetuate inflammation. Exercise has ambivalent aspects in autoimmune disease management. Moderate exercise has effects of reducing inflammation, relieving stress, and balancing the immune system. However, excessive exercise can actually increase stress hormone secretion and suppress the immune system. Contact with nature plays an important role in healing. Studies show that exposure to natural environments has effects of reducing stress hormones and regulating the immune system. Like Japan's forest bathing concept, spending time in nature helps physical and mental recovery. Chapter 8: Social relationships and support systems. Humans are inherently social animals. Our health and happiness depend deeply on relationships with others. For people with chronic diseases like rheumatoid arthritis and Crohn's disease, social support can have actual therapeutic effects beyond simple comfort. Surprisingly, research results show that social isolation increases inflammatory cytokine secretion. Loneliness causes a chronic stress state in our body's immune system, making it react as if there's infection or injury. This can be particularly problematic in inflammatory diseases like autoimmune diseases. Looking at the social difficulties faced by autoimmune disease patients, there's first a lack of social understanding about the disease. Many autoimmune diseases are invisible diseases that don't manifest externally. When someone who looks healthy on the outside suddenly says they're sick, surrounding people find it difficult to understand. "You look fine though?" is one of the most frequently heard hurtful comments by patients. While such comments may come from good intentions, they give patients the feeling that their pain is not acknowledged. Difficulties at work or school are also significant. Rheumatoid arthritis patients may need to arrive at work a little late due to morning stiffness, and Crohn's disease patients may miss important meetings or exams due to unpredictable abdominal pain. This can give the impression of being an unreliable person. Here, adding a slightly cynical perspective, modern society's performance-centered culture is particularly harsh on autoimmune disease patients. The mindset that being sick is also an ability further isolates people with chronic diseases. The pressure to live according to healthy people's standards brings additional stress to patients. Complex dynamics also work in family relationships. Families want to help patients, but sometimes they can actually burden them with overprotection or wrong advice. Comments like, "If you think positively, you'll get better," can give patients the feeling that their pain is being ignored. More delicate issues arise in relationships with lovers or spouses. Physical changes due to disease, difficulties in sexual life, and uncertainty about the future can affect relationships. Some patients avoid or end relationships because they don't want to burden their partners. But not everything is dark. Support groups and online communities for autoimmune disease patients are actively operating. Meetings with people who have the same experiences provide great comfort and practical information to patients. The relationship with medical staff also, importantly, affects treatment. Medical staff who listen to patients, provide sufficient explanations, and treat patients as treatment partners can enhance treatment effectiveness. Conversely, authoritative and one-sided medical staff can increase patient stress. Reasonable accommodation at work is also an important issue. Flexible working hours, remote work options, and easy bathroom access help autoimmune disease patients continue their work lives. This is also a legally guaranteed right. It's also noteworthy that the quality of social support is more important than quantity. A few deep and meaningful relationships can be more helpful than many superficial relationships. The existence of one person who truly understands and empathizes can sometimes have more healing power than dozens of superficial comforts. Chapter 9. Autoimmune diseases from the perspective of Hwalib, Korean traditional martial medicine. Now we enter a completely different perspective on rheumatoid arthritis and Crohn's disease. Hwalib is an independent martial treatment method that doesn't belong to the category of traditional Korean medicine. This is an approach that maximizes natural healing power by regulating the energy flow of the entire body, rather than simply suppressing or managing symptoms. The core principle of Hwalib lies in the dynamics of Qi. Qi means life energy in Eastern philosophy and medicine. Translated into the language of modern science, this is a concept encompassing electrochemical activity at the cellular level, nervous system signal transmission, blood circulation, lymphatic circulation, and bioenergy systems we don't yet fully understand. From the perspective of Hwalib, rheumatoid arthritis and Crohn's disease are not simply immune system malfunctions. Rather, they are phenomena that appear as a result of blocked or imbalanced energy flow throughout the body. Like flooding or drought, when river flow is blocked, various disease phenomena can appear when qi flow is not smooth. Here, adding a slightly cynical perspective, modern medicine tends to treat the human body like a precision machine. It's an approach of finding broken parts and repairing or replacing them. But the human body is not a machine. It's a complex and dynamic energy system where all parts are organically connected. In Hwalib, autoimmune diseases are interpreted as qi reversal phenomena. This is a state where qi that should normally circulate flows backward or is blocked, causing the body's defense system to fall into confusion. This is similar to a situation where cars move randomly because the traffic signal system is broken. In the case of rheumatoid arthritis, Walib often classifies this as a spleen-kidney-yang deficiency state. It's viewed that insufficient yang QI in digestive and kidney functions leads to poor circulation of qi and blood throughout the body, causing cold dampness to remain in joints and inflammation to occur. Crohn's disease is interpreted as a complex state of spleen-stomach weakness and liver qi stagnation. It's seen that fundamental dysfunction of digestive organs combined with liver dysfunction due to stress causes intestinal wall inflammation. Walib's treatment approach for autoimmune diseases consists of several stages. First, the patient's overall energy state is assessed. This is not simply listening to symptoms, but a process of comprehensively observing pulse, tongue condition, abdominal tension, acupoint responses, and even changes in the patient's eyes and voice. Qi circulation regulation is one of Walib's core techniques. The goal of treatment is to normalize the flow of qi through the 12 regular meridians and 8 extraordinary vessels. Particularly, the spleen meridian of foot tai yin and lung meridian of hand tai yin are viewed as closely related to immune function. In the case of rheumatoid arthritis, treatment centers on acupoints around joints. Qi and blood circulation is improved, and inflammation is alleviated through acupoints like Guqi, Hegu, Susanli, and Sanyin Jiao. In Crohn's disease treatment, abdominal acupoints play important roles. Organ function is restored, and inflammation is calmed centered on acupoints like Zhongwan, Tianshu, Guanyuan, and Qihai. Breathing plays a very important role in Walib. It's not simple abdominal breathing, but breathing regulation methods that combine intention to gather qi in the dantian and circulate it throughout the body. This has effects of balancing the autonomic nervous system, reducing stress hormone secretion, and calming immune system hypersensitivity. Manual therapy is also an important treatment method. It regulates QE flow by stimulating precise acupoints. Particularly, a technique called opening meridians and connecting collaterals is used to open blocked meridians. This is a completely different approach from modern medicine's physical therapy, working to open energy pathways while transmitting the practitioner's QI to the patient. Purification decoction method is one of Walib's unique treatments. This combines traditional medicine's moxibustion with Walib's manual therapy, focusing on resolving cold qi in the body. In Eastern medicine, chronic inflammation is often viewed as related to deficient cold states. Amazing results are being reported in actual clinical practice. There are cases of patients who suffered from rheumatoid arthritis for years showing remarkable improvement through Walib treatment and lifestyle improvements. Among Crohn's disease patients, cases of significantly alleviated symptoms through long-term Walib treatment are also reported. However, Walib is not a panacea. It plays a complementary role rather than replacing existing medical treatment. Modern medical treatment must take priority during acute exacerbations, and Walib helps restore overall body balance during stable periods. One important concept Walib emphasizes is mind-body unity. The body and mind are one inseparable system. Therefore, in treating autoimmune diseases, not only physical symptoms, but also mental and emotional states must be considered together. Conclusion: New horizons of hope. Through this long journey, we have examined the complex diseases of rheumatoid arthritis and Crohn's disease from multiple angles. From modern medicine's perspective, of course, but also including the world of intestinal microorganisms, mind-body connections, the influence of social relationships, and even traditional healing methods like Walib. These two diseases are certainly complex and challenging situations. However, the message I wanted to convey through this audiobook is not despair, but hope. Along with the treatments modern medicine provides, we have more choices and possibilities available to us. The most important thing is for patients themselves to become the subject of the treatment process. While receiving professional help from medical staff, they should listen to their body and mind signals and find their own path to healing. Living with rheumatoid arthritis and Crohn's disease is not an easy challenge. But through this process, we can realize more deeply about our bodies, about the true values of life, and about the preciousness of human relationships. Here, adding a slightly cynical perspective, modern society is selling the illusion of perfect health. But does perfect health really exist? All humans have some form of vulnerability. Autoimmune diseases may not simply be bad luck, but opportunities that make us reflect on the true meaning of life. Scientific and technological advances continue. New treatments are being developed, and personalized medicine is becoming reality. Microbiome research, gene therapy, and regenerative medicine are presenting new possibilities for autoimmune disease treatment. However, technological solutions alone are not the answer. We also need to fundamentally reconsider our way of life, reducing stress, getting closer to nature, forming meaningful relationships, and listening to our inner voice. The holistic healing perspective that Hualib presents is even more meaningful in this context. This is an approach that improves the quality of life as a whole, not simply managing symptoms. Finally, I have words to convey to rheumatoid arthritis and Crohn's disease patients and their families. You are not alone. There are many people walking the same path, and there are people who understand and support you. And above all, please believe that there is amazing healing power within yourselves. I would like to conclude this long story with a Bible verse. Romans 8:28 says, "And we know that in all things God works for the good of those who love him, who have been called according to his purpose." Although you may be going through difficult and hard times now, I believe that all these experiences will ultimately become part of a process for greater good. I express deep gratitude for your courage and patience, and sincerely hope that this audiobook will be a small help in your healing journey. I pray that health and peace will be with you. Finally, if you would like to continue encountering such beneficial content, please subscribe to our YouTube channel. We will share more information and wisdom for your health and happiness. Thank you.